all. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. I hope that you're all doing well. So the discussion today is a study from Bangladesh. This is a small study about ivermectin. It shows results that are positive for ivermectin. So while we look at the study, I'm going to request you to check something out. The study is actually composed of three arms. The one group of people or patients were given ivermectin for 5 days. That is actually something that I do. Another group was given ivermectin 1 day plus doxycycline for 5 days. And then there was a placebo group as well. So in my opinion, their conclusion was that the study proves that ivermectin alone is more efficacious compared to the other two groups. I actually think that this study design was a tiny bit incorrect. The incorrection, or the thing that for me was different, is ivermectin should have been 5 days in both cases, and then with doxycycline or without doxycycline. So my takeaway for this study is actually that ivermectin by itself for 5 days versus primarily doxycycline with some support from ivermectin and placebo. So when you look at it, please give me your comments. How do you see this study? And is my observation correct or not? So let's look at the study. So, sorry, Mbal is saying YouTube took down an ivermectin video on another channel. To tell you the fun part in this all, I was talking with a friend of mine who is a practicing doctor and very, very capable doctor. And I was saying that, hey, have you looked at some of the therapies that are very promising? And he said, which therapies? And I said, ivermectin, for example. And I could see a very sarcastic smirk on his face, which could tell me that he actually believed that I was in those nutcases who believe in these kind of therapies, while the right therapy is going to be the dexamethasone or remdesivir. However, it is actually very, very clear that remdesivir and dexamethasone are not as powerful as ivermectin is. And the my own observation is that all the patients that I have been managing nowadays, these are the patients who were actually started on remdesivir and dexamethasone, and then they were not doing well when their family members reached out to me and asked me to look into them or their situation, and then I would start ivermectin and they'll start turning around. So this taboo of the drugs that may be useful is continuing. And I think the fault is not just with the doctors. I believe that doctors at this time should keep themselves up to date. They should look into the data by themselves and not listen to anything from me or from news media. Fine, they do their own research. That is what is their job. However, the medical leadership, for example, NIH, or for example, CDCs or FDAs, these are the places that should have actually taken the lead to look into these things and then come back and say, guys, all of the medical community, check this thing out or check that thing out. We think there is something here and we think there is something there. That is basically the gap. And so when the leadership is missing, then underneath, the folks who are working, they are just listening to the things in the news media, then the social media is creating these taboos, and then the result is the right therapies are not finding good places and good respect for them. So anyways, let's start with our discussion. Very first thing, Cool Beans updates. Nina is super happy. I sent her the health insurance for her whole year, $2,400 today. So thank you very much to all the Cool Beans who have donated. One tiny mess up that I had done was that I started the donation on GoFundMe for $2,400 for her. And then Margaret had kindly sent me $600 separately through PayPal. And so while that was sitting in my PayPal, there was $2,400 on the other side that filled in as well. So we actually raised 3,000 instead of 2,400. So from the GoFundMe, I have sent her 2,400, and now we still have left 600. So I was asking Margaret that how would she like to repurpose that. So, but thank you very much for overwhelmingly helping me and helping Nina have a good holiday gift, and hope that she, if need be, can go to a doctor. She has other chronic illnesses as well. She was super happy. She sent me a message today that my father has passed away many decades ago, but if he was present today, this is what he would have done for me. And so she was very, very grateful. So thank you all to you. It's not me, it is you who did it. So with this, let's continue our discussion. Somehow this computer of mine has become slow nowadays. Since the Apple update has arrived, this computer has become slow. So this is the ivermectin Hero. And yes, somebody had noticed last time that the ivermectin Hero does not have a nose. So yes, he doesn't have a nose. So ivermectin, the Hero, that we actually need, and that is actually present, and some of us are not using it. So with this, continuing with our discussion, an apology for the slow scrolling screen. So here is the study. Study is out of Bangladesh, Dhaka. It is a randomized study, so that is good. It is a double-blind study, that is also good. It is a placebo-controlled study, so that is good as well. What is probably a weakness of the study is that it is a small study, 24 patients in each arm. The drugs that they use, so check this one out, notice this one. Drugs, or the therapies that they used, oral ivermectin, 12 milligram for 5 days. This is actually something that I do. I start patients on oral ivermectin, 6 milligram in the morning, 6 in the evening, and I continue for 5-6 days. And I do not relent until the patient has started bouncing back. Then their second part of the therapy was oral ivermectin with doxycycline, in which ivermectin was given only once, day one. And then on the day one, there was 200 milligram doxycycline as well. And then for the remaining 4 days, or an additional 4 days, there was doxycycline 100 milligram given every 12 hours. So 200 milligram daily for another 4 days. So 5 days of doxycycline and 1 day of ivermectin. I actually think that right here is the weakness. The weakness is that if we wanted to actually see ivermectin plus doxycycline, and then say ivermectin alone is stronger, then we should have combined them in the similar way and then come back and said, you know what, ivermectin with doxycycline actually looked weaker than the ivermectin alone. But here the study design is such that ivermectin alone is given for 5 days and doxycycline is given for 5 days. So in my opinion, it is more of a study to say, what about ivermectin given for 1 day versus ivermectin given for 5 days? And what about ivermectin given for 5 days versus placebo? Or what about ivermectin given for 1 day versus placebo? That is the kind of study and the results we can see from this one. I don't think that the takeaway of ivermectin is better alone compared to ivermectin plus doxycycline is the right takeaway of this study. That still allows us to look at ivermectin and see that how much better it performs when there is a placebo group. So let's look at the patient profile. So what they had done was, the patients, so all of the patients were RT-PCR positive. The other interesting thing you'll see over here, patients were 72 and all of them were hospitalized. So this is not a study of early aggressive treatment. This is actually a study of when a patient has actually been in the hospital. and has been admitted to the hospital. So the patients were aged 18 to 65. Fever in majority of them was present. Cough, sore throat was present in majority of them as well. The objectives, what were they measuring? They were measuring, number one, virus clearance, that how quickly can ivermectin or ivermectin plus doxycycline, how quickly can they clear the virus compared to placebo? Then remission of fever and cough and sore throat, meaning how quickly the symptoms go away. I have usually seen that the symptoms start going away within 2 to 3 days. And then secondary endpoints that they wanted to observe were, number one, will the patient continue to require more and more oxygen, or will the oxygen need start becoming less? Then the duration of hospitalization and all-cause mortality. So these were their objectives. And I should actually show you the, so this is drbean.com. And we just started the year-end sale as well. So if you wanted to take advantage of it, this is a good time. Here is the study itself. The study is published in the International Journal of Infectious Diseases. Here is the study. This is the link to it. I have marked some pieces in here. And in the results, something that annoyed me, and it is just me being, I think my own writing style is even bad. But here, what they have done is when you're reading this, please know that in the beginning, when they are presenting the results, for example, here, if you say, look at this, at enrollment, 82.6% of patients in the placebo group, 73.9% patients in the ivermectin plus doxycycline arm. So over here, they're calling it a group. Over here, they're calling it an arm. And then 77.3% in 5-day ivermectin group. Then again, it became a group, were recorded. So the sequence in which they put the numbers is placebo, ivermectin plus doxy, and then ivermectin alone. However, as they proceed in their discussion, they flip the sequence, and then they talk about ivermectin alone first, and then ivermectin plus doxy, and then placebo. So they flip the numbers, and it becomes confusing if you're not paying attention, and you have to kind of correct them again and then understand them. So there is a slight problem with the way the results are presented. Anyway, so this is the results here. This is the study itself. On the clinical trials, they have not yet posted the results. These would need to be updated. And if you see here, the drug therapy is ivermectin plus doxycycline plus placebo, and then ivermectin plus placebo and the placebo alone. This is the company that had supported them. So this is an article on that company's site. I have no financial or other interests or connections with these companies that have supported them, neither with this company that has also placed an article out here. So with these links are present in there. Going back to the discussion here. So this is the patient profile, and this is the study objectives. So now let's look at the study itself. So they had 24 people. These were hospitalized patients. So again, it is not an early study. 24 who were receiving ivermectin for 5 days. Another 24 who received ivermectin for 1 day, and then doxycycline for 5 days. And then another 24 who were on placebo. That was the division. And then finally, the results. And my table became a little bit upside down because their results were all over the place. They were the way they were written, it didn't make sense as I followed, and I put the results here. So there is some mess that is created in this table, but I organized it. It's just that now I have put numbers here and there. So let's look at it. First is duration of hospitalization. For duration of hospitalization, the ivermectin group has 9.6 days average, but the range was 7.7 days to 11.7 days, and the P was 0.93. So P 0.93, again, I know that some of the folks here are going to say that who are you to say 0.05 is the most important part? But I would say that because that is what scientifically is accepted to be significant, we can put significance to whatever number we want. However, in their own study as results as well, they use 0.05 as a significant cutoff point. So here, 9.6 days, ivermectin plus doxycycline 9.7 days, and the placebo 10.1 days. But if you look at their confidence intervals, 7.7 to 11.7, 8.1 to 11, so these are the number of days you can say, the ranges, and 8.5 to 11.8, so not much difference in the number of days. Then the fever, cough, fever on day 0 when they came in, and then fever after 7 days of medication. So here, if you see ivermectin group, 77.3% had the fever. I hope you can see them. My apologies if these numbers look a little jumbled. 77.3% had fever in ivermectin group, the patients on day 0. And then they had 100% of them had become afebrile. That means they didn't have fever after 7 days. Ivermectin and doxycycline group, 73.9% had fever on day 0. And then 94.1% had fever on day 7. 94.1 had become afebrile on day 7. So only 6% had fever. And then in placebo group, 82.6% had fever on the day 0. And then on day 7, 84.2 were fever free. So that is the fever results. And again, not significant statistically. And let me spill the beans right now. The only significance you would see is in the viral clearance. Then if you look at the dry cough, so day 7, day 0, the patient has cough, and day 7, the patient does not have cough. So if you look at the ivermectin group, 81% of the patients in the ivermectin group had cough on the day 0 when they were admitted. And then by day 7, they have been given ivermectin, and 61% had become free of cough. I would have taken it the other way. If I was putting the numbers together, I would have said on day 1, on day 0, 81% had cough, and on day 7, 41% had cough, and 61% had not. Anyways, ivermectin and doxycycline. Day 0, 82% had cough, and day 7, 63.2% had cough. 63.2 had become were cough free. So this is just a mess with the numbers, sorry. And then placebo, on day 0, 65% had cough, and on day 7, only 40% had cough. These numbers are not significant. So not a big deal here either. Then is the viral clearance. This is the area where ivermectin actually showed the results. So if you see here, ivermectin group, 9.7 days, the virus was cleared in 9.7 days, and the range was 1.1 to 4.7. So in some people, within 1 day, the virus was cleared. And in some people, 14.7 days later, the virus was cleared. So there was a range, and on average, it was 9.7. On the other hand, if you look at placebo, this was about 13 days that the virus stayed on. Ivermectin and doxycycline, 11.5 days. Again, I do not know how to really look at this group because the ivermectin is not used more than once. Even in prophylaxis, ivermectin is used day 1 and day 4. So here, it's not even a prophylaxis equivalent. This is one stat dose of ivermectin and then doxycycline. Then virus clearance on day 7 and day 14. This was global virus clearance, overall virus clearance. Day 7 and 14, 4.1 is the hazard ratio, and then range is 1.1 to 14.7, as I mentioned before. This is significant. P is 0.03. So this is the important takeaway from this study. Did the study show that the ivermectin works? Yes. Here is that result. Did it show that the result, the comparison of ivermectin and ivermectin plus doxycycline, is that a fair comparison here? No, I don't think so. And so, and finally, CRP, the C-reactive protein, and LDH, markers for the inflammation, they were significantly low in the ivermectin group compared to placebo. They did not compare it to ivermectin plus doxycycline. So compared to placebo, these were significant. So that is the total discussion for today. I want to quickly look at this data over here as well and just have you walk through this. So if you see here, in the results, they're talking about total patients. Then they talk about duration of hospitalization in this paragraph. Then they talk about the patients and their clearance, the symptoms, sore throat, fever, cough. Then they talk about viral clearance. And that is where the money is, that the viral clearance was done early on with ivermectin. And then here is their discussion, which is a 5-day course of ivermectin resulted in an earlier clearance of the virus compared to placebo. And that P is very good, 0.005. So for this result to randomly occur, it is going to be a chance of 1 in 1,000. So that is a very good, significant result. In the 5-day ivermectin group, there was significant drop of CRP and LDH by day 7, which are indicated by the disease severity. So that is also very important. Look, if the inflammatory markers continue to increase, that means the patient can become dysregulated anytime and get out of our hands. So when the ivermectin start curtailing the inflammatory markers, that means the chances for cytokine storm are reduced. Again, giving it early is better than at this stage, but still it shows very good results here as well. So in the absence of comorbidity, a 5-day course of ivermectin treatment showed faster SARS-CoV-2 virus clearance compared to placebo, and the P is 0.02, which is also significant. So that is the discussion for today. I thought it is a very interesting study for us to look at. So here we are. So there is a, Falcon says, I'm kind of confused. So Falcon, that is the problem. The way the study is designed, ivermectin plus doxycycline and then placebo, and then the way the results are written are kind of confusing. I would actually give you this very simple takeaway. The simple takeaway is ivermectin given for 5 days, 12 milligram daily, versus placebo has significant viral clearance by 7th day. And that significance is P equals 0.005. That is significant. So Cesar Zatrian says, so am I. So I hope this last statement kind of clears it up. How is everyone doing? So there is a question from Bob. Dr. Bean, do you recommend ivermectin weekly or monthly for prophylaxis? I believe that FLCC Alliance recommends monthly. So I am slightly different from Alliance. So if you look at it, if you start from Dr. Campbell, he doesn't talk about these things. If you go to the Alliance, then they are adherent a little more towards ivermectin is usually prescribed once in a 6 months or once in a quarter. So maybe once a month is sufficient. I look at the ivermectin's half-life, which is about 18 hours. And the therapeutic range of ivermectin is 150 microgram to 200 microgram per kilogram body weight. I usually give it on the lower end, that is 150 microgram per kilogram body weight. But then I look at the clearance, that half-life is about 18 hours. So for me, every second or third day, ivermectin should be taken. So my prophylaxis usually is at least ivermectin twice in the beginning, day 1 and 4, and then maybe the whole month you go by and then do the same thing every month. That is my safe side. And the ones where I am more worried about them and I'm sure that they can take this drug, I usually give them ivermectin 12 milligram every week. So my own family members that are in the other countries where they can get ivermectin, this is what they are doing. Again, the things that I'm saying, these are just for my patients. These are not a prescription for anyone here. Arun says, is doxy essential? So Arun, this is the study that actually tells us that doxy is not essential. And this is a discussion that happens so many times with my doctor friends, that they say azithromycin, for example, when the hydroxychloroquine and azithromycin combination was started, after the World Health Organization stopped the hydroxychloroquine from that Sergi-Sphere debacle, doctors started using just the azithromycin. They said, well, this was a combination, so if you take the hydroxy off, you still have azithromycin. So azithromycin is an antibacterial. So fine, it is good for antibacterial, but not for the SARS-CoV-2. So similarly with doxy and ivermectin as well, original study that came out, it showed that doxy plus ivermectin are useful together. Their usefulness together is that when you have a viral infection, when a patient has viral infection, it is possible that they would get bacterial infection as well. And especially if you're giving them steroids, then you have reduced their immune system's power, and then they can get opportunistic infections or secondary infections. So for them, giving doxycycline is fine. Otherwise, if you just give ivermectin for 1 day and then say, all right, I'm going to give doxy for 5 days and doxy should do some kind of a miracle, and we have proved it doesn't do a miracle, that is just in general wrong. Doxy is not supposed to be helping for SARS-CoV-2. It is the ivermectin. Machiavelli says, I read it works for both COVID and prevent, but that's my opinion. So Machiavelli, I've done a discussion, ivermectin works, and I've placed all the mechanism of actions together. Caesar says, do I have the right to request it? Caesar, I do not understand what does that mean. Requested from Rich says, if ivermectin is used for anti-inflammatory properties, an 18-hour half-life dose, a dose every other day makes sense. Correct. It does, but please realize, if you're going to take anti-inflammatory, then there are better anti-inflammatory, for example, steroids, if somebody really needs them, or there are other anti-inflammatory as well. Ivermectin, when it is taken for SARS-CoV-2, there is antiviral effect, and then there is anti-inflammatory effect, and then there is immune dysregulation, stabilization effect. And let me say this antiviral effect, this is becoming a very popular statement. Even the statement by the FLCC's doctor towards the senators in that hearing, he was saying it's a very powerful antiviral. I believe he was saying that. If not, then I'm mistaken. I heard it from someone else. Ivermectin is not an antiviral. I have said it many, many times. I've explained the mechanism. Ivermectin causes the virus it disrupts the virus's cargo to nucleus, so that the nucleus of our cell continues to ramp up our defenses, plus release the interferons that would ask the neighboring cells to ramp up their defenses as well, and they would take care of themselves in front of the virus. So ivermectin has no antiviral effect. It has a tissue strengthening effect, and then it has anti-inflammatory effect and immune regulation effect or modulation effect. So Muhammad Zubair says, question, ivermectin for prevention of reinfection? So yes, so if you're taking ivermectin as a prophylaxis, then again, I would always continue to correct that reinfection simply means arrival of the virus in us again. That can happen anytime, even if we are vaccinated, not vaccinated, recovered before, not recovered before. However, will the virus cause disease and symptoms and tissue damage? That is when we should be concerned. And that is what ivermectin-like things help reduce. Barbara says, that makes perfect sense. Thank you. Nabu says, I think countries like India, it's better to take doxycycline with ivermectin too. Absolutely. So there is a place, for example, in this study, I would have loved if the study was ivermectin alone and ivermectin for 5 days plus doxycycline for 5 days. That is a fair comparison. And so that was not done. Ivermectin 1 day and then ivermectin 1 day with doxy and then ivermectin for 5 days, they don't make good comparison. Kent says, get ready, Dr. Bean. Ivermectin is going to be a very hot topic since the congressional hearings today. Get ready. The press is going to want your expertise. Keep providing education. It's working. Absolutely. And I had tweeted out today that we started talking about ivermectin somewhere in March, April. And the succession is, there was a study from Australia that talked about ivermectin in vitro. Then there was a study from, an observation from Dr. Alam from Bangladesh, that he had used ivermectin with doxycycline for about 80 people. Then I was the one who actually started talking about it and presenting it. And then there is a lot of spread out there. So we were one of those early ones who looked at it and looked at the mechanism and started discussing it. I have started using it for my patients as well with beautiful results. Jem says, hello, everyone. I'm a bit late. No worries. Welcome. So any other questions before we break for today? So there is a Ref P. How can this be? Does doxycycline interfere with ivermectin more than it is useful for preventing opportunistic bacterial infection? So no, Rev, the results that were different is just because ivermectin was just given once. And these are the patients who are already hospitalized. So the viral load in them is going to be a lot. So one static dose of ivermectin was probably not sufficient enough to cure them or to support them a lot. Maybe it was sufficient enough not to let them progress to the severe cases, but not sufficient enough to make a big mark. So then to say that, well, the doxy would do the rest of the job, that is what doxy is not going to do. But in those patients who were given ivermectin for 5 days, they actually had very good results because you are continuing to provide support while ivermectin is helping eradicate the virus through the tissue strengthening and the anti-inflammatory and immune modulatory mechanisms. Just my secret, I actually do not stop ivermectin until I see that the patient's oxygen saturation has come back to 96, 97. So I don't care it is 5 days or it is 7 days or it is 3 days. When the patient's clinical situation improves, that is when I stop with the ivermectin. So far, I do not have any side effects in my patients. So ivermectin may be harmful in some dose, but so far it has been working fine. So Harry says that today I saw Dr. Pierre Corey explaining the benefits of ivermectin to Senate committee and was asking NIH to relook at the drug. This is something you've been saying for months. Absolutely. And even I believe that Dr. Paul Marik had looked at one of my videos. He actually took a snippet from it as well to use in his initial very first talk and his very first presentation. And lucky for us that we were kind of, the reason I believe is this: I look at the mechanisms before the rumors and suggestions. And so mechanism tells a lot, and from there you can go. So we had looked at the mechanism a lot more. James, how are you? I've asked my Canadian doctor for ivermectin, but naturally doctors are hesitant as they have their careers, their license, and their families to protect to do if doctors say no. I feel compelled to still thank them and understand totally. My doctor is debating and consulting, but that is not approved in Canada, which is unfortunate. Totally agree with you, James. My only heartburn is doctors have to rise up. They have to figure out that there is something that is useful, do their own study, don't listen from Mobeen and somebody else. And then if they find something is useful, then try it for their patients. Ivermectin is a safe thing. That is where I feel bad if a doctor just simply rightly says, I'm not going to use it. Ben says there's a question. Have you seen a video from Dr. David Sheem where he says the problem with COVID-19 is actually vascular occlusion due to red blood cells clogging up. I have not, but this is one of the problems at a later stage, not in the early stage. Pasi says, that's why I love Dr. Bean clearly explaining. Thank you very much. Hiber Zenon says, thank you for your great work and God bless you and all of the scientists who work for the bad media and all world who make so much evil gains. Absolutely. And I wish more and more doctors did this. I do not wish that they come back and say Mubin said it, so that is why we did it. But I really wish that they look at these studies by themselves. It takes about half an hour for a doctor to go over these studies and then decide that what should they do. Cool. Shahida says, yesterday I had a long 150 minutes discussion on COVID-19 with my students instead of a routine class. Very fruitful. Could do it because I learned from you. Thank you very much. Shahida, you are very welcome. Are you a doctor and do you teach medicine? Jem says, my doctor, Yale trained, denied prescribing me ivermectin even after showing her the studies. I love her, but this is how strong the wall is right now against NIH recommend. Absolutely. I'm telling you, the doctor who I was talking with is a good friend of mine. And he believes in my work a lot. He very often sends me notes that, hey man, I love your videos. And for ivermectin, as soon as I said it, and the smile I saw, the sarcastic smile I saw on his face actually told me that no need to talk more because he was not open to it. So Jem says, why would they do that? So people like me who are diabetic and immunocompromised are left on their own early on, which counts the most. This is criminal in this way that they should look at it. Cool. So there is a Seema says, can you comment on the following ivermectin clinical study in the dosage size, 600 microgram per kilogram to 1200 microgram per kilogram daily for 5 consecutive days to be considered a toxic dose. So look, more than 200 milligram per more than 200 microgram per kilogram is not therapeutic. It is above the safety range. So I know that Dr. Merrick says that you can go to more than that as well. And as you're saying here as well, I take a different route. Instead of loading a patient with a large dose right in the first day, I actually just give them therapeutic dose, but I keep giving them again and again. So that allows the body to take care of some of it. The half-life occurs and some of the drug is removed, and then I give the drug again. So I don't take a risk with the patient, but I also don't let them slip into, and I don't want to jinx it, touch wood. I also try that they do not slip into the worst case. So Umesh Azain says, your work is great. It helped me with arguing and supporting novel treatment options like vitamin D. Absolutely. Thank you very much. Cool. So this is the discussion. There's one more. Bill says, have you read the Corman Dalton external review paper on the PCR test? No, not yet. Cool. So everyone, thank you very much. Please like, subscribe, and share these videos. I was actually thinking of creating a playlist of the ivermectin videos only. And if you wanted to support my work, there is a link in the description. You can use that to support my work. Thank you very much and have a good night. Stay happy and healthy, and I would see you tomorrow.